respectful age and allowing aging in place. But there's one area that I have encountered in my law practice where that's become quite a challenge. And that is as people age or have handicaps, they have to often put additions onto their homes. And when you do that, you want to have one floor living. And so you tend to spread out rather than go up. And when you spread out, often you run afoul of the coverage in the zoning ordinance. And the planning staff so far has never recommended approval for a variance to go over your coverage due to an addition that a handicapped person wants or an elderly person wants. I think they may have done it one time that of a case I'm not involved in, but none of my cases I've ever had a favorable staff. And that makes it a challenge. And we've had to really work very hard. And out of my 5 cases, I've actually gotten 1 approval. And so the reason I'm coming to you all is I have just filed a case for a gentleman by the last name of Niemer, and he's going to be living in a wheelchair very soon. And his doctor wants him to get outside, experience sunlight, and he has to put on a deck, and that's going to increase his coverage, and we're going to file for a variance. And I don't understand why the county is so resistant to granting these variances. They just think it's a bad thing and should never be done. And yet they're running afoul of the legislation that Patrick Hope got the General Assembly to pass recently. So I'm here hoping that you all might be able to assist with somehow getting the staff to quit being so strict, I guess is the right word, on these variance requests. And that's all that I have, and I appreciate your time this morning.
Hey, thank you, Mr. Lawson. Much appreciated. Yes, I've noticed that issue, and I didn't realize they were so rarely approved, especially for a case of an older person that deserves consideration. So yeah, please keep in touch with us, and I will also refer this to our housing committee and see what we can do.
Wonderful. Thank you all very much for your time.
Yes, sir.
Thank you, Mr. Lawson.
Thank you.
Okay, Helen.
Anyone else wanting to offer public comment this morning? Okay, hearing none. We can move forward and welcome Jim Ferguson, who is the Executive Director of Legal Services of Northern Virginia, and he's here to just give us an overview of the services they provide for older adults in Arlington. So, Jim?
Yeah. Morning, everybody. Thanks, Helen. I have a PowerPoint, so I don't know, Helen, does somebody need to make me a presenter, or is that already?
I think you should be able to just share your slides, Jim.
Okay, so let me give that a go and see if we can make that happen.
It looks good.
Can you see them?
Yes.
Okay. All right. So as Helen said, I want to give you a brief overview of who we are, what we do, and then specifically talk about the services that we provide for older Arlingtonians, and then leave some time for some questions, hopefully. So let me kind of zip through this. Legal Services of Northern Virginia is a nonprofit law firm. We've been in existence for 44 years. We've been a presence in the community for 44 years. Our mission is to provide access to justice for disadvantaged individuals and communities. We have a staff of 75. That includes 45 lawyers. We have 7 branch offices throughout the region. So in addition to our office in Arlington, we have offices in Fairfax, Prince William, Loudoun, Alexandria, and we even have one as far south as Fredericksburg. In the northern Virginia jurisdictions, we provide a full range of services. So, for example, we go to court with our clients or administrative hearings, that kind of thing. In the Fredericksburg and surrounding jurisdictions, we just do more limited services, provide advice, maybe do sort of a letter to a landlord, that kind of thing. In talking about what we do, we sometimes find it's easy to first clarify what we don't do. So we don't do any criminal cases or criminal defense. We don't do any traffic related cases. We don't do any immigration related matters. We also don't do class actions or fee generating cases. So all of our services are free. They're entirely free. We don't charge anybody for the work that we do. And the work falls into about 5 main practice areas or substantive law categories. Family law and domestic violence is a big one. It's our biggest in terms of volume, in terms of the number of cases that we do in a typical year. About 40 to 45% of our cases are family law cases. Most of those involve some element of domestic violence. We're helping a survivor of domestic violence get a protective order. We're helping them get custody of their kids, that kind of thing. In addition to family law, we also have a pretty vibrant public benefits practice, working on things like disability, Medicaid, Medicare, SNAP, unemployment benefits. We work on overpayments and appeals of denials. And then also the one area where we actually do get involved in enrollment is on health insurance. We in the marketplace, we have several health insurance navigators, we call them, who help people sign up for insurance under the system. And they also help them sign up for Medicaid. In addition to public benefits, we also have a housing law practice. And that is, first and foremost, it's helping low-income families, low-income clients avoid eviction from, it could be private landlord tenant situation, it could be subsidized housing, but we also do work on foreclosure related matters and housing conditions cases, bed bugs, lack of heat, lack of, that kind of thing. And more recently, because the law changed to allow for these, we've worked on eviction expungements, helping people get evictions cleared from their record so that it doesn't harm their ability to rent property going forward. So consumer protection is another big practice area for us. We are representing the consumer, and it's in a wide variety of different types of cases. The common denominator is basically we're trying to help low-income folks hold on to what limited financial resources they have. So maybe they've been sued on an old credit card debt or an old medical debt, that kind of thing. Maybe they're having a bank account garnished or a paycheck garnished. We will represent them in those types of cases. We also do some bankruptcy related work as well. And then we also have our elder law practice, and I'm going to speak about that in much greater detail, but we do things like, for example, advanced medical directives, wills, powers of attorney, guardianships, nursing home discharge cases. And like I said, I'll talk more about that in a second. And then finally, we have a low-income taxpayer clinic. We have clients who come to us with a whole host of different legal issues, but often they also have a dispute with the IRS over unpaid taxes, and we represent them in those disputes, and we are fantastically successful in getting the amount that they're required to pay to the IRS either completely eliminated or significantly reduced. The elder law practice. In each of our main jurisdictions, we have an elder law attorney or elder law advocate. In Arlington, that is currently a gentleman by the name of Ben Apt. I hope you've had a chance to meet him. And we handle core elder law issues. So that's nursing home and voluntary discharges. It's, as I mentioned, public benefits, uncontested guardianships, and the preparation of what we call personal declaration documents. That's your wills, powers of attorney, advance directives. And then the last point on that slide is particularly important to emphasize. We also do all the other types of cases that we do in our other practice areas for elderly clients. So if, an elderly client is facing eviction from a private landlord, if an elderly client is a survivor of domestic abuse or intimate partner violence, we'll represent them in getting a protective order. So it's these sort of elder law specific types of cases, but also more broadly, everything else that we do. So I mentioned nursing home discharge cases. We get involved in these at various stages, and sometimes it's just negotiation with the nursing home that resolves the situation, but it can rise to the level of an administrative law appeal with the Virginia Department of Medical Assistance Services. The uncontested guardianships, I think the emphasis there is really on these are in the most severe cases of incapacity where we come in and represent the family in getting the guardianship. These are hearings that take place in Arlington in the circuit court. As I said, the personal declaration documents, wills, powers of attorney, advance directives. The wills that we do are generally simple wills where there's not a significant estate with lots of different tax consequences. You might know that under the Older Americans Act, we represent everybody, or we offer our services to everybody, regardless of their financial situation. But that is limited in a way in that the services that we provide are generally appropriate for somebody who does not have, a significant estate, because we don't have that expertise. We do have the expertise to do these more basic documents, and that's the service that we provide. And then again, all other types of cases. So it could be an eviction, it could be a protective order, could be a consumer protection type situation as well. Accessibility for our older clients. We get very clearly that the older clients that we're working with sometimes have accessibility challenges or barriers in terms of mobility, hearing, vision, mental capacity. And so we stand ready and willing to meet with clients wherever they need us. So whether that's in their home or in a hospital for a will signing, we stand ready to do that kind of thing. In fact, we do it all the time. Accessing our services. It says 4, and there are 4, but the 3 primary ones are calling us, and that's 703-778-6800. We have an online application, and that's at lsnv.org. Or people can walk into our offices on Wednesdays. And then a newer service that we're offering is sort of a preliminary application that can be done via text. And that's where you see number 2 there, text LSNV to that phone number. and it's sort of a preliminary determination of eligibility. So contact information, you can contact us at help@lsmv.org. You can contact me at jferguson@lsmv.org. Again, our general intake number 778-6800. Our main administrative office is in Fairfax, but our office in Arlington is currently, I emphasize, at the corner of Columbia Pike and Glebe, but that's only for another month and a half. In December, we will be moving, and it likely will be, we haven't signed on the dotted line, but we're very close to doing that with an office that's right across the street from the courthouse. So it'll be a very convenient location in terms of, the metro and just in terms of proximity to most things in North Arlington. So that concludes my PowerPoint. So I'm going to stop sharing. Did it effectively stop? Are we back to the main screen?
We are.
We are. Great. Excellent. And so I see that William has his hand up. William, is there a question that I can answer?
Hey, Jim, thank you very much. Really appreciate it. Two questions and then two bonus questions. So
that sounds like fun.
Yes. So first one is how can we add value and work with you guys? Second, is there any outreach that you guys do or we can work with you? So those are the two main questions. And then the bonus ones are pro bono. Do you, in addition to your 45 attorneys, do you get pro bono, and do we have to be barred in Virginia? And finally, language, is there any, you guys, I'm sure you have, interpreters and that sort of thing for people with different languages. So anyway, just throw that out there. Thank you.
Yeah. And so it might be easier for me to take them in reverse order. We do work with volunteers all the time. We do hundreds of cases on a pro bono basis every year with volunteer lawyers. I think you do have to be admitted in Virginia if you're going to do the actual representation. And then we actually do a pretty good job with interpreters. We have an in-house interpreter program with volunteers. We have about 75 volunteer interpreters who help us communicate in about 30 different languages. And then when that doesn't work, we have a language line type service that we use. That's just a little less expensive than language line. We do a fair amount of outreach. I think we work pretty closely with the AAA folks in terms of value added and helping us interface with the older community in Arlington. That's a long-standing relationship, and I welcome Helen or anybody else to weigh in on that. But the relationship that we have with the Arlington AAA, I would say, is more, sort of helping us focus on our day-to-day work serving older Arlingtonians than any of the other relationships we have with AAAs throughout Northern Virginia. It's pretty good, I would say. Charlie, I see your hand up, Charlie. But you are muted if you're talking. I don't know.
It actually looks like
thank
he's
you.
frozen.
Thank
Okay.
you. Thanks, Jim, for that presentation. It's great. A question about walk-ins. You said walk-ins are taken on Wednesdays. Does that include the Arlington office, or is that just in your main office?
No, that's in all of our offices. Yeah.
Great.
We have a vision for 25 of increasing that to a second day, probably Fridays, but we will widely publicize that when we do.
Oh, that's great. Just a quick second question. You mentioned the guardianship cases that you handle. It sounded like you handle the families petitioning for guardianship in cases that are uncontested. Do you also ever represent the respondent or represent the guardian of a low-income person after the guardian's been appointed?
Theoretically, we could do that if there was no conflict of interest. That happens a lot less often, but there's nothing sort of standing in the way of us doing that.
Great, thank you.
Yeah. Wendy.
Yeah, just a quick question. I was curious what the volume of work is related to older adults versus your entire clientele. I mean, you've got a huge mission there to help everybody.
Yeah.
And what percentage or volume, roughly, is focused on older adults?
Yeah, no, that's a great question. So we have a very high volume practice, as you correctly surmised there. So Northern Virginia wide, we do about 5,000 cases a year. I would say the older adults tend to be sort of in the 10 to 15% range, I would say, of our total caseload.
Thanks.
Sure. Kathy.
Yeah, thank you so much for the presentation. I was curious, and maybe you mentioned this, but in addition to Older Americans Act support, how else do you fund the services for older adults? Because I imagine OAA doesn't cover the need that you see across your offices.
That is a true statement. The only way our budget works to have a law firm with 45 lawyers in it that doesn't charge our clients anything is to cobble together financial support from dozens and dozens of different sources. So the county provides us with a general grant. We have some state funding, we have some federal funding, and then I spend so much of my time working with private funding, and we have a natural constituency there in lawyers and law firms. Many of them are very generous and ready and willing to provide support. And then foundations, corporations, it needs to be that broad based for it to work.
Okay.
William.
Thank you.
Jim, yeah, real quick. Is there a one pager or something that either our volunteers can, I haven't looked on your website, so this is that our volunteers, when we do outreach, we can tell people about, hey, here are the key things, here's how to contact, something like that.
Absolutely. I will email that to Helen. I'll also be happy to email this PowerPoint if that would be useful too. But I can definitely send you, sort of a brochure type thing.
Thank you, Jim. Yeah.
Peggy?
Good morning. I do have a question. Do you represent any seniors who are veterans when they are in need of assistance with VA benefits, pensions, healthcare access through various organizations, etc.?
Yeah, I'm so glad you asked about that because I left that off. We have a number of different sort of special projects that I didn't mention because I knew the presentation was going to be so brief. We have a project specifically focused on serving low-income veterans, and it specifically helps with accessing veterans benefits. For many of them, the first step, and it's a big first step, is getting their discharge status upgraded because they otherwise are not going to be able to access a lot of those benefits. But we do provide that range of services for low-income veterans as well.
Thank you.
You're quite welcome. So maybe that's it. I'm happy to take one or two more.
I have one more question.
Absolutely.
It's dealing with Medicare, Medicaid.
Yeah.
Do you serve any clients when they are in need of long-term care planning, when they don't have that services? They have not planned for it, but they need some kind of assistance when they go into these nursing homes or whatever they go?
So we would make a referral in that situation. That's not expertise that we have in-house. And so, we would consult with, for example, the AAA folks who are the right people for them to talk to, but that's not expertise that we have in-house.
Okay, thank you.
You're welcome.
Great, thank you so much, Jim. Really appreciate it.
Thanks. It's great seeing you all. Have a great day.
Thanks, Jim.
Thank you. All right. So our next item on the agenda is Ms. Adrienne Fine, Assistant Arlington County Attorney, FOIA and Conflict of Interest. Always appreciate it. Had some legislative updates, so look forward to it.
Good morning. Can y'all hear me? Thumbs
Yes,
up?
thank you.
Yes. Okay, great. I am having a little bit of technical difficulties here, so I'm going to try to share my screen, but if not, we're just going to do it live and we're just, we'll make it work. So, okay, I believe it should be sharing a PowerPoint presentation now.
Yeah.
Okay, great. Okay, well, thank you so much for taking the time. My name is Adrienne Fine. I am an assistant county attorney here in Arlington. And here today, we're going to do an overview on the Virginia Freedom of Information Act and COA, and we'll go from here. We can visit any questions at the end. I will ask if you have any, since this is a public forum and it's being recorded, if you have any personal questions about the Conflict of Interest Act and the specific circumstances you have, I'd ask that you, we take it offline rather than, in the public meeting, because provision of legal services in a public meeting is, difficult. But I'm going to give a general overview and hopefully it will be helpful. So for those who are not familiar, the Freedom of Information Act is a state law that governs access to records and meetings of public bodies to residents of the Commonwealth and representatives of the media. So you are agents of the county in your capacity on this commission. So you have the same obligations as employees as it pertains to records that you're creating that are not in the control of the county. And you have the same responsibility as the other public officials to avoid having improperly convened meetings. So these obligations are to retain records related to public business for the required retention period, to provide those records for inspection upon request by a resident. That is performed centrally by the county, but your obligation would be to provide them to our office when we request them, and then to provide notice of public meetings. Again, providing the notice to the public is done centrally. However, your role is to ensure that you're not having improperly convened meetings. So a question only lawyers could ask is, what is a meeting? A meeting is anytime 3 or more members get together formally or informally, in person or electronically, and public business is discussed or transacted. So this applies to any meeting, including work sessions and subcommittees, and it is wherever the gathering is held, with or without minutes being taken and whether or not votes are cast. So if 3 or more of your group are together discussing public business, that is going to be a meeting under FOIA, and it does have to be properly noticed or it is an improperly convened meeting. So things that are not a meeting, gatherings of employees, gathering or attendance of members at a public forum where candidates are appearing and debating, and then also any place where you're not transacting business. So, if 3 members of this group, your kids are all in Boy Scouts together, you don't have to drop one of your kids out of Boy Scouts to avoid, having public meetings at the Cub Scout meetings. It's a meeting is prefaced on public business being transacted. We do caution to avoid the appearance of, transacting public business, making it clear that that's not what's going on. But under FOIA, 3 or more members gathering together is only a problem if public business is being transacted. If public business is being transacted, it needs to be noticed. So if it is a meeting, what does FOIA require? Notice that has to contain the date, time, and location of the meeting, posted at least 3 working days prior to a regular meeting in a prominent location in the staff liaison's office and on the county website. So reasonable notice is given for special or emergency meetings. Again, I understand that you're not personally required to give the notice. This is just to give you an idea of what the legal obligations are for the meetings. Additionally, it is required to be open to the public. So All meetings of public bodies, including advisory groups, are open to the public, including meetings and work sessions during which no votes are cast or decisions made. There are few limited exceptions for closed meetings. I don't believe that this group ends up hearing matters that are appropriate for closed session, but some of those exemptions are to discuss litigation, to discuss personnel matters, to discuss certain pending transactions like a proposed purchase of land or things along those lines. But they're limited, and they should not be convened without discussing with the county attorney's office whether that's appropriate. Media or members of the public can record meetings, so they cannot disrupt the meeting with their recording equipment or by being, overly aggressive about it, but anyone can record a public meeting. Voting must be public. No secret ballots or written ballots are allowed, and generally non-emergency electronic meetings are not permitted without qualifying, meeting the requirements of electronic meetings, which we'll discuss a little bit later. So those are the requirements of openness for public meetings. Additionally, meetings have to have minutes. They're required for any meeting. They have to include the date, time, location, and members present and absent. It has to have a summary of matters discussed, proposed, deliberated, or decided, and the votes taken. While the minutes are in draft format, they are still released to the public if somebody asked for them. So draft minutes are not exempt from FOIA requests for documents. How detailed to get on the minutes is a little bit of a matter of preference. Different groups get different levels of detail, but these are the actual legal requirements for the minutes. So I will move to electronic participation, and then I'll see if there's any questions about the meetings. I'll see if there's any questions about the meetings before we move over to some of the documents. So, Audrey?
Are you ready to take questions about meetings?
I wasn't going to, so yeah. I will. I'm seeing with my technical issues, I'm not able to log into my county computer, and I am not sure if this is the most updated version of this PowerPoint on the electronic participation component. So as I go through that, we'll, yeah, I think it is not. So if it's about that, then we'll pause on that, but go ahead.
I'm trying to get clarification on what a meeting is. So we have 3 members on our committee. So 2 would be quorum. The co-chair and I regularly get together or by phone or for coffee to discuss the agenda for the next meeting. Is that official? Is that an official meeting that has to be posted?
So I'm sorry, can you explain it again?
The co-chair and I get together monthly to discuss the agenda for the upcoming meeting. That's quorum. We meet quorum for that. That's 2 of 3. Does that meeting have to get
quorum? How many are on the commission at large? You're saying the subcommittee is that small?
The subcommittee has 3 commissioners and a number of non-commissioner members who are not counted.
Okay. I mean, the default would generally be, so I may need to discuss this further with you, but the default would be that if it's quorum, that it is a meeting. That's the default. We can discuss further about what impact the non-commissioner members might have on this. I'm not familiar with that arrangement, but I do think this is something that I can coordinate with Helen to get more information about, because that does, I mean, the default, unless there's some circumstances that I'm not catching on the fly here, the default would be that would be a meeting if it's a quorum. So, but we can discuss. So you said you meet on the phone or like in person?
Sometimes we just have coffee, but it doesn't.
Right.
The same thing.
Yes.
And I would imagine that applies to other committees too. But I can't.
Yeah, I mean, I think
we can take this offline, but I would like some guidance.
Yes. Yes, absolutely. I think the question that I want to, again, we're sort of on the fly. I want to look at is it a voting? It's not a voting group. Like, I think
No.
the question that I need to look at is the impact of, it's certainly not a quorum of the entire commission. So what the impact of the quorum of the working group is. But I've written down your question.
Okay. Thank you.
But I would say until we get additional information ironed out, I would say a quorum is a meeting, is the general rule. But like I said, I hear some facts there that are a little bit different than I'm used to. So I'd be happy to look further into that.
Thank you.
Okay. Equals quorum for Audrey Kremer. All right, so going into electronic meetings, this is one area where the law is changing all the time. So I've done an updated presentation, but as I mentioned, I'm locked out of my work computer today. So I'm not able to get to it. So I will just verbally tell you a little bit about the rules for the electronic participation. Since the pandemic, there's been a movement to liberalize some of these electronic meeting requirements. And so the current rule is that members can remotely participate in a meeting for a couple different circumstances. If their member has a disability or medical condition that affects their ability to attend, or the medical condition of a person or family member, or they're the caregiver of a person with a medical condition that renders attendance of the member problematic or difficult, they can participate in meetings remotely, and there aren't limitations on how many times you can do that. And in those instances, those electronic participants do count towards the quorum. I think that was a movement that was made because, if you have too many people on your group that qualify for that exemption, then it's difficult to make quorum. So I think that's great that they've made that change. Additionally, there's the ability to participate electronically if you live more than 60 miles from the meeting location. And then you can also participate electronically if you have a personal matter, and there are requirements to use that electronic participation, which include, notifying the member, complying with your group's electronic participation policy. And then that's limited to either it cannot be more than 25% of the meetings, or 2 per calendar year, whichever is greater. And in those instances, those do not count towards quorum. So that should, that's one of the reasons it's important to let your liaison and chair know that you're planning to use your personal matter participation, because that will help with quorum management and ensuring that they don't have too many people out, making it hard to reach quorum. So those are what I call, remote participation. The other mechanism is all virtual, which is what we're doing today. That is limited to either 2 times per year or less than 50% per calendar year. And then the rule is that there can't be 2 consecutive meetings in a row. So I know that the county has amazing staff liaisons who keep track of the electronic participation, and they keep track of making sure that we're not having too many virtual meetings and all those sorts of things. So this is more of your general FYI. I see there's something in the chat. Rachel, did you want to?
No, I just echoing what you were sharing, that the code that details exactly what you just described. So if anyone wants to reference that, that's the Virginia updated legislation.
Yes, and it's pretty new. The last update just happened in July, so that's why, unfortunately, this is my presentation, my paralegal emailed to me this morning on my personal email to try to, have something for you. So, yeah, I have an updated one, but it's just been from July. So, unfortunately, I've been unable to access it this morning. But yes, it's, I think that a lot of localities really found that it can increase the flexibility of people getting involved in these commissions, and especially in the space of with people with caregiving and things like that, it's a great opportunity to be inclusive. So local governments still don't have to allow these. Some of the commissions don't have to allow these, and so I think it's great that the county is embracing some of these opportunities. So one other item I wanted to bring up is emails and meetings. It's a little probably behind the times. Probably the next frontier on this will be Teamsing in meetings or texting in meetings. But the Virginia Supreme Court has held that emails can constitute a meeting under FOIA if there is simultaneous email communication between 3 or more members. So this is an instance where, some examples could be, let's all get on at 6 p.m. and email back and forth about this document, or the emails are flying 20 seconds, 10 seconds, 1 minute, very, very quick succession. The court has said that those can be meetings. So the best practices for avoiding email traffic crossing into a meeting territory would be, 1, avoiding reply all as a general rule. That will discourage, an extended volleying back and forth from occurring. Another thing is to copy your staff liaison on correspondence. That actually does 2 things. 1, the staff liaison can be monitoring it, if it's sort of the conversation is becoming a conversation rather than just a transmittal of information. The staff liaisons can monitor and say, let's put this on the agenda because there's obviously a lot to say about this, and this is appropriate for a meeting. And additionally, the county will have a copy of the emails as a public record. And it's easier for us to comply with FOIA requests when an arlingtonva.us email is present. Because otherwise we would have to get those emails if they are requested by a member of the public. We'd have to get them directly from the board members and commission members. Whereas if a staff liaison is on the email, we're able to electronically perform searches. So that is a transition to public records. I will probably speed past this responding to FOIA requests slide, so in the interest of time. But a public record is any record owned, prepared by, or in the possession of a public body or its officers, employees, or agents, that's you, in the transaction of public business. So whether you are doing it on your personal cell phone, your personal email, you're writing notes at your house, the mechanism, text messages, emails, what have you, the form is not what controls. What's important is whether it's transacting public business. So if, Commissioner 1 emails Commissioner 2, oh, I heard your child is sick, I hope they're feeling better. That is not a public record because there's no public business being transacted. Commissioner 1, emails Commissioner 2, hey, I see that this is on the agenda. I wanted to share this information with you. That's the transaction of public business, and it becomes a public record. So all public records are to be open to the public unless a specific exemption in the law allows the record to be withheld. So if we receive FOIA requests for records that you would have, you would receive correspondence from your liaison asking you to send over any responsive records. I will say I've been with the county for 3 years or so, and I do not believe that we've had any FOIA requests for any records that commissioners personally would be holding. So it's not that common of an issue, but we're just letting board members and commission members know what their obligations are, and that there's not confidentiality associated with communications that are transacting public business as a commissioner. So very, very briefly, so that I can move on to, I believe, COA here. Yes, okay. When we respond to FOIA, we have to either provide it in whole, withhold it in whole, and give the explanation as to why it's exempt. We can give it in part and withhold it in part, depending on if it needs to be redacted or there's portions of it that are exempt. We can ask for a 7-day extension because we only have 5 working days to respond to FOIA requests. We can tell them that we don't have them, they don't exist, or we can't find them, or we can talk to them about the costs associated with the FOIA request. So if you do receive notification of a Freedom of Information Act request, just keeping in mind those deadlines that we give you that are very tight. They're not our doing, they're the Virginia legislature doing. We do have to get some response to every requester within 5 working days of receipt. So we take the obligation for transparency very seriously with the county, both in having open meetings and with having open records, unless there's an exemption that applies. And we certainly appreciate the cooperation of the staff and the volunteers of the public in meeting those obligations, because I know that it can be quite onerous deadlines. But again, we have not received one for your records in a long time. Not since I've been here. So I wouldn't spend, a lot of time worrying about how to respond to FOIA requests, but this is just to give you a general overview. All right, so then the last part of FOIA is the penalties. So when a violation is willfully and knowingly made, there's a civil penalty of not less than $500 nor more than $2,000, and then it goes up from there. Destruction of records to avoid a FOIA prior to the retention period is a civil penalty of $100 per record. That is when a FOIA request comes in for a document and someone were to shred it or otherwise destroy it after the FOIA request comes in. That is, obviously not appropriate, and there are, significant penalties associated with those things. So in addition to the penalties, again, with FOIA, it's really about encouraging just living up to the values of transparency that Arlington County, is committed to. And so in addition to the penalties, we have all our other principles that, make FOIA really important to comply with. So I have a short slide on COA, but does anyone have any other questions on FOIA? I think hearing none. Okay, sorry, wasn't sure what I heard a beep. I wasn't sure what that meant. All right, so the State and Local Government Conflict of Interest Act is a Virginia criminal. It has criminal penalties, and it is the Virginia state legislation and regulation of conflicts of interest as defined by the act. We have a sort of layman or colloquial definition of conflict of interest, but the state code itself defines what a conflict of interest is for the purpose of this law. So that's when, if you or a family member has a personal interest as defined by the statute, that may be affected by the actions of your group, you may have a conflict of interest that could either disqualify you from participation or require public disclosure of the conflict before you participate in the matter. So they define personal interest as when you, your spouse, or dependents living with you expect to receive $10,000 or more annually from a property or business, own an interest greater than 3% in a business, or own more than $10,000 interest in real or personal property. So if your advisory group is considering a matter that relates to your personal interest, you may have a conflict of interest. You should reach out to your liaison, and they can help get some legal advice as to what may be required. It does specifically exempt certain matters or transactions. So if you are ever concerned about whether you have a conflict of interest, it's very fact specific. So please reach out to your liaison to get some advice on whether that's something that you can participate in. Any knowing and intentional violation of COA, as it's called, could result in criminal prosecution. So it is important to regulate. I mean, I think that in addition to the criminal statute here, I think there is also the concern of appearance of a conflict of interest, which also can have an effect on the public. So we always want to ensure that we're definitely complying with the letter of the law. And then, you know, if you ever feel like you have a conflict of interest that doesn't rise to the level of essentially a crime, like violating the statute would be, you can always recuse or disclose to the public or take whatever steps you feel would be necessary to ensure that you are, you know, living up to the ethics and transparency that's appropriate. William?
Yes, thank you, Adrian. Just real quick question. Can you give an example of a conflict of interest that relates to boards or commissions?
Sure.
And is it like is there an issue that came up that we usually get the FOIA piece? Was
Right.
wondering if there's a conflict of interest issue that arose. Thank you.
Sure. I'm gonna make one up. So I'll do the clearest one I can think of. I am on the planning commission. I own a piece of property and it's coming before the board to get rezoned for commercial. I clearly have a conflict of interest in voting on that, right? I have a financial stake one way or the other. I may have even personal, you know, whether I have personal feelings about it is not what the Conflict of Interest Act, but to vote on a property that I own more than 3% of, or I make more than $10,000 in annually from it would be a clear conflict of interest. I think some of the places where it, you know, I think most people can kind of understand that. I think it gets harder when it's grayer. So, you know, I'm the president of a nonprofit and I'm on the county board. And there is a discussion about starting a new grant program for nonprofits. Do I have a conflict of interest? Those are the sort of grayer areas. I would say under the statute, I'd say not legally. Now, if my nonprofit is now coming before the board asking for the money, okay, now we're probably edging into statutorily a conflict of interest. But I think the grayer area is when it's more in the general terms. So I think it's a hard line because we want people involved in boards and commissions that are in the community because they have the expertise. And then, you know, I think the law draws the line where you have a financial and pecuniary interest in the transaction. Was that helpful or did that just make it muddier?
No, that was very helpful. And
okay.
And I just wanted to add that on the FOIA part, sort of patting ourselves on the back, we were part of a group that sought an expansion of virtual meetings because it enables, you know, Virginians who are older or low income or in the rural areas to, you know, actively participate in civic life as we're doing now. So yeah, we like that.
That's great. I mean, I think it's a hard balance between, you know, making sure that people that don't necessarily have as much access to, you know, the internet and things are not being excluded from public meetings, but then also making sure that we get as many people to participate as possible. So I think the legislature is making frequent updates because, you know, the technology and the circumstances are changing so frequently. So we appreciate the board's members' patience with the limits that we have for electronic participation. And, you know, we really appreciate being nimble on that. So I have, I think that is all the time I probably have. But if we have one more question, it's up to staff whether we continue. But otherwise, I do, Audrey, I will contact with Rachel and Helen to ensure that we can further have that conversation offline, because I certainly understand your perspective, and I just want to make sure that I have all the right facts before I give the full answer. But if anybody else has anything, that's fine. Otherwise, thank you for your time.
Yeah, thank you, Adrian. Really appreciate it.
Great, thank you.
Thanks, Adrian.
All righty. Looks like the next item on the agenda is approval of the September meeting minutes. Are there any questions on that? If not, we will. Is there a motion?
I move that we approve the minutes.
All right. Any second?
A second.
Okay, thank you. All in favor, just by acclamation? Great.
Aye.
Great.
Aye.
Any opposed?
Aye.
All right, hearing none, the meeting minutes are approved. Thank you. Next, I'm going to hand it over to Helen and Rachel and Maimuna for the staff reports.
Thank you, William, and good morning, everyone. It's good to see all of you online. Appreciate you all being here. So I have just a few things that I'd like to discuss. First and foremost, it is officially Medicare open enrollment season. Kicked off on October 15th, and so the team is seeing a good, healthy volume of emails and phone calls for people wanting to review their Medicare plans and potentially making updates. And so we're off to a great start. If you or someone you know would benefit from the work of the VICAP team, which is free, unbiased information about Medicare, certainly the best way to reach them is either by phone, 703-228-1725, or emailing them at medicarehelp@arlingtonva.us. And I'll put those in the chat after I conclude my comments. And also big thanks to Charlie and also to Mike Schuster, who's online. They're volunteers with our VICAP program. We really appreciate your assistance with this. There is a great group of volunteers that Michelle Thomas leads up. And so very dedicated group of volunteers, and we appreciate their work, not just during open enrollment, but also year round. Okay, last month I mentioned that we have awarded a contract for the Senior Loop. We're going to change the name of it to the Arlington Shoppers Loop so that we're not using ageist language in the names of our programs. This new service will start on November 4th. And we're really excited. It's going to feature not just the new name, but we'll have a dedicated call center for the older adults to call. There are some new routes, new stores potentially for folks to visit, and we'll have a new registration form. So we're currently reaching out to resident services coordinators to make sure that everybody who is currently enrolled in the program is enrolled in the new program so that we're ready to ride on day one. So super excited about that. Last month, I also talked about the Aging and Disability Resource Center limiting their walk-ins on Fridays. I counted back today. That's actually been in place now for about 8 weeks. And it is definitely, I would say, going very well. We do have folks that show up on Fridays, but if it's not one of the emergency situations like shelter or their utilities have been disconnected, they do get the packet of information, and everybody seems to be doing great with it. So, and I know the staff definitely appreciates the extra time to catch up on notes and other administrative items. So we're going to continue in this mode for a while longer, as long as it continues to go well. Let's see, the recruitment process for both the Aging and Disability Resource Center supervisor, as well as a human services clinician for the Aging and Disability Resource Center, are underway. Both postings closed on Friday morning. And so waiting to see the list of candidates, and we will continue the recruitment process for both those positions. The next Arlington Alexandria No Wrong Door Advisory Council is scheduled for October 29th. And this is a joint meeting, just basically to bring service providers together to talk about how to better provide services for the older adults in our communities. And since we share so many providers with Alexandria, we thought it makes better sense to combine our efforts for this one particular meeting and do it jointly. So that next meeting is October 29th. It will be at the Fairlington Community Center at 1:30. And it's going to feature a presentation on brain injury services, including discussions about stroke as a brain injury. And so really looking forward to that. And then finally, I recently attended the Fall Virginia Association of Area Agencies on Aging meeting, or V4A, that was in Charlottesville at the beginning of October. V4A is really working hard to advocate for the additional funding for agencies on aging. They're working right now to see if we can get that ask included into the governor's budget that will be released on December 18th. And then the Governor's Conference on Aging will be held May 19th and 20th of 2025. And that will be in Williamsburg at the Williamsburg Lodge. And so more information about registration on that will come soon. Any questions for me? And if not, I will turn it over to Rachel.
Great. Thank you, Helen. Good morning, everyone. Hope everybody is enjoying these cooler fall-like temperatures. It's great to see everybody. A few of the updates that I want to share. I want to give a huge shout out to Tanae and to our Aging and Disability Resource Center, especially. We had shared earlier that Arlington had been selected as a benefits enrollment center. We're one of 3 in Virginia. And since we've started, we've served 239 individuals, connecting them to over 500 benefits, but 64 core benefit applications. Right now, we've been busy with the LIHEAP, or the Energy Assistance applications. So just again, thanks to Tanae and the ADRC team. We have a number of different outreach events scheduled for the next quarter, including an outreach fair at Path Forward, one of our shelters. So again, if anyone is interested in joining as a volunteer for the VEC or with our outreach events, please let me, Tanae, or Helen know, and we'd be happy to connect you and plug you in. We've also shared the sad trend about homelessness increasing amongst older adults, and to help combat this, we launched the task force to address older adults experiencing homelessness and housing instability. Our next meeting will be on October 28th, so next Monday at 10 a.m. It will be on Microsoft Teams. We'll hear an update from Trina Van, who oversees the continuum of care, as well as from HUD about some of the different housing options and funds available to address older adults who are experiencing homelessness. We'll also provide an update on some of the creative partnerships that we have with our housing nonprofits to connect older adults to housing, either permanently or transitional housing. But there's some really exciting things that are happening here in Arlington. The last 2 weeks, we had our Age-Friendly Ecosystem Summit. It was very successful. Arlington, as part of Age-Friendly Arlington, partners with Alexandria, Washington, D.C., Hyattsville, Montgomery County, and then 2 jurisdictions in North Carolina. Each day we had over 100 people, with I think 250 as our largest number of attendees. This is something we plan every year. So if you have any feedback or thoughts for next year, please let me or Maimuna know. Maimuna had a chance to present last Wednesday about the RAP program, and it was very well received, with many suggestions for we need to replicate this model nationwide. And we know we feel the same way. An update about adult protective services. On November 1st, the state is requiring that APS will now have an online reporting tool. Adult Protective Services, for the first time nationally, has federal regulations, and as part of those federal regs, having each state having an online reporting tool is one of the requirements. So this is not to replace people calling in or coming into the office to make reports, but it creates an additional method for individuals to make reports of abuse, neglect, or exploitation. So once that launches through the state, I will make sure that everybody has that information. And then our team, our Adult Protective Services team, again, is very small, but they work 24/7, including holidays, to receive those reports. And if they need to respond immediately, they do, but ensuring that they're in compliance with all of the regulations. I'll put in the chat, but the county has released an additional round of the race equity grants. This is an opportunity for nonprofits to apply. And so there's some information that is on the website about sort of the different grant guidelines and opportunities, but please do share with your networks. It's a great way to promote race equity and ensure that Arlington is living out some of our values, the same of which this commission adopted, I think, a year or 2 years ago. And then lastly, I think I saw him, not on my screen right now, but I want to make sure that everyone wishes Link a very, very happy 90th birthday. I hope you didn't eat too much cake or party too hard over the weekend, Blink, but happy, happy birthday. You truly are a living legend, and we are so grateful to you. And again, just know that we are a better community for everyone because of your many contributions. So thank you, and happy birthday.
Thank you.
All right, I will hand it over to Maimuna.
Oh, thank you, Rachel. Thank you, Helen. Good morning, everyone. I actually came to the auditorium. I didn't check my schedule appropriately. I was ready to see you all in person. But it's great to see you virtually. And a warm happy birthday, Link. Oh my goodness. That's incredible. And I'm sure that you have some more wisdom to give us in this new decade that you're entering. But in terms of updates, Helen and Rachel do a fine job with the updates, so I'm not going to share much. I just want to give to our department. Anita Friedman, our director, is leading an effort for us to have a strategic plan. And this is the first time in, I don't know, maybe 2 decades that the department is establishing a strategic plan. And I want you to know she's meeting with the leadership right now. It's in draft form, but I'm pleased to say that the age-friendly plan was one of the plans that was considered for the strategic plan for the department. So there were a number of other plans, but age-friendly was definitely a part of that. So kudos to this commission. And some of the guiding principles that we're looking at as a department include racial equity, of course, and I know that this commission adopted the racial equity lens, and inclusivity, prioritization of people who experience systemic disadvantages and vulnerabilities, which is a target population I know for this commission as well, person-centered and holistic services, staff well-being, and integrated services and impactful results. So under those guiding principles, there will be some outcome areas related to the social determinants of health. So more to come on that. It's in draft form, but definitely something to share with this commission because I do believe that the age-friendly plan does dovetail with a lot of the outcomes, and certainly something to keep a pulse on as you continue having outcomes and successes with the age-friendly plan. And then my second announcement and final announcement is that we are embarking in November on Caregivers Month. So this is, of course, October is Breast Cancer Awareness Month, among other recognitions, and then our caregivers, which a lot of you are caregivers or have been caregivers, or definitely know someone that's a caregiver. I'm not sure what your November calendar is, or you already probably have that scheduled, but hoping that some of that can be a focus on caregivers. And so I'll connect with Helen and Rachel to see how we can incorporate that for next month. But thank you all for what you do and how you show up and how you serve and represent the needs and disparities of our community. I'll turn it back over to William. Thank you.
Thank you so much, Maimuna. And and I just want to say again, that, really appreciate our dedicated and energetic and innovative and knowledgeable and expert county staff. You guys are always there to, support all the older adults and our commission. So really appreciate that. Thank you so much. Great. And so thank you for also highlighting that the age-friendly plan was incorporated or somehow referenced in the strategic plan. So looking forward to looking at the plan. Segueing into the chair's report, I just want to highlight that, yes, age-friendly plan, I guess it's about maybe 1 year birthday now. We have an innovative plan that we took a relook. I know we are executing it energetically, and please send your reports to Kathy, because we want to see in sort of a bullet form. We don't need long narratives on where we've been and where we're going. So thank you so much, and keep collaborating and reaching out and advocating for older adults. And with that, unless there are any questions, I'm going to transition to the next item, which is committee and work group updates. So if Carlos and Roland are ready, we can start with aging, equity, and engagement.
Well, this is Roland. I don't know whether Carlos is here, but I don't really have anything to add to the report that we have. We have a long list of pretty much items there that we've been working on, but I'm willing to answer any questions that anyone has on it.
Great, and thank you, Roland, for your committee providing the reports. They're very helpful so that we can all get a nice summary and see where we've been. So, do we have any questions for aging equity, for Roland specifically? I know you guys went to a number of engagements and housing, transportation. Any questions? Any other highlights that you want to give?
No.
Great. All right. Seeing none, I will move on to legislative. Anthony, how are you doing?
I'm good. How's everybody doing?
Great. Thank you.
So we met on the 23rd of September. Our next meeting is the 13th of November at 9 a.m. In our September meeting, we discussed NVAN breakfast highlights. There were a lot of conversations that were had with delegates and NVAN volunteers. So Terry has been, excuse me, Terry has been busy compiling, the conversations that were had at the various parts of the NVAN breakfast. We discussed some of our outreach with advocacy groups to support those NVAN items as NVAN volunteers, and got some guidance from Helen on that, to be approaching those advocacy groups, 501c3s and others, as NVAN volunteers. We got notification from Helen that the NVAN grip card was sent to Ilana which is the county liaison. And then we also decided on no legislative breakfast this year, that it's going to be better to meet with legislators individually and each of the NVAN groups. So there's, multiple items here, both legislative and, excuse me, each of those items, we're going to be setting up meetings, Zoom calls with legislators individually versus the NVAN breakfast, versus the legislative breakfast, which we have done in the past. That's all I have for the legislative committee.
All right. Does anyone have questions or comments regarding legislative? All right. Thank you all so much for that work. So yes, after NVAN, it sounds like there's an opportunity for members to participate in further advocacy with the members. So yeah, please take part in it. It was a lot of fun, and I think it was good to build relationships with our members. Long-term care residences. Amuna and Charlie.
I can go, and then Charlie, I'll punt it to you. So we met last Tuesday at Vitality. Vitality is an assisted living community on Wilson, and we had a very engaging discussion around the community. Avenel, who is the administrator, Jarkel, presented, and she shared some illuminating facts with us. And if I can get my notes, I will share that. Let's see here. We also heard from a young man who is in our developmental disabilities community, and Vitality has employed him, and he shared his work experience and how meaningful it's been for him to provide support to the dementia care unit. And so this is an opportunity for our committee to learn about ways to help other communities see that employment can extend beyond the traditional ways of employing individuals, and also look at our developmental disabilities community as being employable. And so he gave a very enlightening talk, and we are scheduled to go to other communities. This will be the year that we're looking to go to other assisted living and nursing homes on site, and hear from them about their communities, their challenges, their census, and the like. I also wanted to mention that next Thursday, let me just look at my calendar. We are going to be hosting a kickoff meet. Oh, actually, this Thursday, we're hosting a kickoff meeting for the Cherrydale Advisory Board. So that is at 1 p.m. And this is a carryover from last month, where you heard from the Cherrydale Administrator, Tremaine Goddard, and we talked about revitalizing the Community Advisory Board. So Charlie and also Kristen, Commissioners Charlie and Kristen Johnson, will be a part of this kickoff. And we're going to be talking about our purpose, the purpose of the community advisory, the membership structure, putting together the schedule, and suggested meeting topics. And Kate Kramer, too. We've invited Kate Kramer. I think she's here with us. That's all I have to report, Charlie. Did I miss anything?
Not hearing Charlie, but
Charlie,
really...
you're on mute.
Sorry about that. I keep defaulting to mute and not realizing it. I think people might be interested in a little bit more about the profile of Vitality, because it's an assisted living facility that's licensed for 200 beds, but they generally only have much less than that. Currently, at the time of our meeting, they had 119 residents. And it's, just on Wilson Boulevard, just east of Ballston. And it's a 9-story building. The first 4 floors are memory care, and floors 5 through 9 are regular assisted living. They have about 30%. I found it interesting that about 30% of the residents there have no family support. So these are isolated elders who are getting care there, and that's such a very common phenomenon that we see. The memory care portion of the facility is the maximum capacity of only 24 residents. So it's a small, very focused type of care, which was very impressive to hear about. When asked about what their biggest challenges were, the number one issue that Avanel mentioned was mental health, not enough resources for mental health issues. So that's, even in a care setting like that, it's the same theme that we're hearing across the county. Anyway, those are just a couple of additional facts I wanted to share.
Yeah, thank you, Mamuna and Charlie. Yes, thank you for visiting those residences.
Yeah. If
yeah,
I may, I think
go ahead.
I think
Who's
it's
that?
also it's Linda.
Okay.
It's also kind of eye-opening that the fee structure is $8,400 to $9,200 a month, which I think is pretty telling. And their average age is what, 92? I think I heard.
Wow.
So
yeah,
it's
92.
a very high level of care for elderly at a very high price. I mean, and they have a wonderful staffing ratio too. They say it's 7-to-1 in memory care and 10-to-1 in assisted living. Sorry to interrupt, but I thought.
Yes, thank you.
They have one auxiliary grant resident there, but even that person pays more out of pocket than the auxiliary grant provides.
Well, thank you all for highlighting those things, and thank you for visiting, because like Charlie said, they're isolated. So yeah, thank you for doing that. So many things that we want to get involved in, but thank you for dedicating your time and energy to that. Next, Catalina, transportation.
Hi, everyone. So one big thing I want to update everyone on. Last month, I mentioned that I'm joining the advisory group for Arlington's Transportation Future. So earlier this month, there was a kickoff meeting for that advisory group. And again, the Arlington's Transportation Future is a county initiative to develop a refreshed transportation plan. So this will ultimately replace the 2007 Master Transportation Plan, and serve as the transportation element of the county's comprehensive plan. So this is just the beginning of a longer sort of like 18-month effort to engage the community and sort of envision what everyone wants the transportation of the future to look like in Arlington. So the plan is going to be developed in 4 phases from fall 24 to 2026. And so there are a lot of events going on now to engage the community and give feedback. So I went to one last week at Central Library, which was the first open house. And there were tons of people there. They had boards up, and you can like literally talk to folks from the county and just like talk about the experience with this intersection or sidewalks or what have you. So I encourage folks to get out to some of those if they have some time. I think we have already gotten over 900 responses to a questionnaire that is like an online form you can fill out while you're on site, or you can fill it out from home, and like 600 comments on the interactive map, which is where you can specify specific places where there are issues or things you want to flag. So a lot of different ways to share input. There's actually a pop-up today, which is like a mini open house from 3 to 7 at Penrose Square on Columbia Pike. And then there's another tomorrow at National Landing Water Park on Crystal Drive. And then there's an open house on Saturday at Arlington Mill from 10 to 1. So definitely encourage folks to get out. But all that said, coming out of the kickoff, the advisory group chair, Chris Slatt, who I think some of you may know, and the Arlington County project manager for this effort, Kristen Calkins, they asked all of us on the advisory group to connect with our respective commissions, encourage people to think about transportation and provide a response to a specific set of other questions. So I'll just rattle them off quickly, but essentially after this meeting, I'm going to send a quick email with a Google form and ask that you all just sort of, all the commissioners, take time and reflect and try to answer these 4 questions by 11/6, which is a Wednesday. So it's like 2.5 weeks from now. Should be really short. And if you don't have any comments, it's like, you could put NA or something like that. But the questions are like, how does wear the Commission on Aging hat and think about the work that you do, but also more broadly, just the experience of older adults in Arlington. How does your commission use the existing master transportation plan? What does your commission hope the refreshed transportation plan includes? What does your commission see as the biggest transportation challenges facing Arlington? And what does your commission see as opportunities for transportation improvements, et cetera? So I'm hoping that after everyone provides some feedback in the Google form, I'll just sort of consolidate all of that. And then our next transportation committee meeting is on Friday, 11/8. It's from 9 to 10 a.m. and it's all virtual. So I encourage folks that are interested and able to attend to sort of meet me there and the rest of the committee and just sort of talk through further any points that you raised in that. So I can make sure I have a really reflective summary response to the advisory group. And then I'll bring that to the advisory group in early December when we meet next. So again, the point of my role here is just to sort of be the liaison. So I want to make sure I'm capturing adequately all of the points that you all have, and then they'll take that in addition to all the other inputs they're getting from the community through all these pop-ups and open houses, and that'll all be used as part of the visioning process. But it definitely won't be the last time that we share input or that they come back to us with more information. So just the first step, but would definitely appreciate that. So I'll send an email later today after this meeting, so it's clear. But thank you. I'd really appreciate any responses to that.
Do we have any questions for Catalina?
I do. This is Claire. I'm on the phone. Can you hear me?
Yes, we can. Thank you, Claire.
Regarding transportation, I would like to continue advocating for the Super Saver Senior Taxi Program. I don't know if I have the words in the right order. Regarding transportation, currently the program only allows 20 booklets, which are worth $20 but cost 10. And I advocated for a reduction in that price earlier. But I'm also advocating in terms of transportation, if they're only allowed 20 booklets a year, which is really not a lot. And I'm advocating right now regarding transportation for an increase in the number of yearly booklets from 20 to 36. I know it's a big jump, but if you think of 36, it would only be 3 booklets a month, and booklets are spent very, very quickly. Taxi fares, even within Arlington, sometimes can come close to using up one $20 booklet. So I'm hoping that we can be successful in perhaps for the next fiscal year to increase the number of booklets from 20 to 36. I think our vulnerable adults on limited income would greatly benefit from that increase. Thank you.
The Transportation Department is developing its strategic plan going out to 2035. What should transportation be for us older people? If you have thoughts, they have some pop-up groups that they'd love to hear from you. The world is changing around us. Transportation is changing, and we can influence what's here in Arlington if you speak up.
Great, thank you.
I'm not sure if it was addressed to me or was a general question, but hopefully my request for the increase to 36 booklets will be addressed, and hopefully we will be successful getting that increase to 36 booklets next year. Thank you.
All right, thank you, Claire. And thank you, Catalina, for representing older adults. And looks like Linda has a question. And also, just real quick, thanks to
Uh-oh. Did we lose you?
I think we must have lost William.
Yeah, I'm
Okay,
back on.
Catalina,
Go
Okay,
ahead,
you're
Linda.
back.
Yeah.
Okay.
okay. Catalina, my question real quick is, will this transportation plan include pedestrian related issues, or is it purely vehicular?
Yeah, so I know I've only had the kickoff call so far, so I'm still sort of getting my arms around everything. But from what I understand, the plan, they're trying to move towards a more holistic and like comprehensive vision that's incorporating all different types of modes. So whether that's metro or driving or walking, I think in the past, what I've heard is that things were a little bit more siloed. And so their goal is to make sure that this new vision and plan is high level enough that you can look out, many years into the future, and it doesn't get too prescriptive on the nitty gritty details, but that has a vision for pedestrians and bikers and other people that might be using scooters or rollerblades or whatever that may be. So I know in the pop-ups and the open houses, there were different boards and you can put input on things like that. So I would definitely recommend checking out the questionnaire on the site that Helen shared too. So the one that's online, there's a questionnaire that's public facing that's due 11/15, and that one's more specific about like how do you get around and like that sort of detail versus the 4 that I'm going to send you guys via email, which is kind of broadly like wearing our Commission on Aging hat, like what transportation challenges do we see and that kind of thing. But I definitely recommend sort of providing input in both places if possible.
So in other words, if you have any pet peeves about transportation, this is our chance, right? Thank you. Yes. So do we have any other questions or concerns? Great. So health and wellness, Linda.
Yes, and I'm sorry, I've been remiss in sending in a real written report. One of our top goals is going to be choosing a leadership as I will be leaving the commission, and I'm happy to stay involved in this committee, but I don't think it's appropriate for a non-board member to be chair. So that's kind of top of list. We had a very good attendance at a meeting on the 6th of September. Jim Meehan, who is the Associate VP of Population Health from VHC, was talking about a really robust and growing system for discharge planning that emulates best practices. So it was very educational to us, and I think really quite important to hear what he had to say. There still seems to be kind of a disconnect between what the patient does and what the hospital hopes will happen. So I don't know if that's an opportunity for volunteers or just making sure people understand a little better. But the hospital is certainly trying to roll out a lot of resources that are, not just medical related, but related to making sure that they have food and they're in a safe environment. So I think that's, I don't know if Kate wants to elaborate on that. Our next, I'm going to stop real quickly. Our next meeting is in December. We meet quarterly, and we're going to, Kathleen is going to talk about the available evidence-based programs that the NCOA has and their database of all programs so that we can reflect on those. So I invite Kate and Kathleen to add additional comment at this time.
Thanks, Linda. I don't think I have too much more to add other than your reference to the hospital. That's the work that's coming under our population health division, which I've referenced in this meeting before over the years. So looking to grow and expand that as much as possible, but it will take a little time. So. Yeah, and in terms of, thanks, the evidence-based health promotion, disease prevention programs that we maintain at the National Council on Aging. It's relevant because the AAA has received a very significant increase in funding under Title 3D of the Older Americans Act, and that's the part of Older Americans Act that supports these health promotion programs to address local needs. So we're going to kind of review the range of programs that funding can be used to support, whether it's, physical activity, falls prevention, chronic disease management, behavioral health issues, substance use disorders, etc. And Ellen, you're able to join that meeting, right? So kind of, look at how those dollars can be used most effectively to address needs in the community. So more on that in December.
Great,
and I think that's an in-person program.
Well, some are, but not all. So many of them.
No. I meant when we meet in December for our meeting.
Yes.
Sorry.
Yes. And I forget where we're actually meeting because Kate, your location is not available, right?
I think Sequoia was secured for us.
Sequoia. Okay.
Yeah.
Great.
Yeah.
All right. Thank you, Linda. And health and wellness. Sorry. Great. All right. Next, housing and supportive services. Audrey and Michael.
Michael, do you want to update? You wrote the meeting minutes.
No, I don't have much to provide just yet. We're working on some programs that we're getting some realignments with what the housing committee is doing. As far as the issue brought up by Mr. Lawson this morning, that does segue nicely into our revamping and coordinating closely with the county staff on what's going on with housing in Arlington, how is the code enforcement being applied, and with the planning that's going on. That's all I have to add.
Okay, then we're good because we have a nice update in the minutes.
Perfect. Thank you. Thank you both so much. Do we have any liaison updates? That's the next item on the agenda. I'll give it a second. Not hearing anything. I see Kathy's hands up.
Hey, this is Kate Kramer with the fire department. I don't know if this is an appropriate time for. No worries. There's a lot of K's on here.
Right.
I don't know if this is the appropriate time for me to do my announcement, but in case you weren't aware, there was a House Bill 933 passed in April regarding Alzheimer's disease and dementia training for dispatchers, firefighters, and police officers. So this was I actually think a really great win. It was recommended by the Virginia Alzheimer's Disease and Related Disorders Commission and the Commonwealth Council on Aging. So the Northern Virginia fire agencies took action on this. 2 weeks ago, we had a presentation from RAFT, as well as a cognitive behavioral neurologist from the Inova Center for Brain Health, I think is what it's called. And they did a really great presentation for us regarding talking to people with dementia, talking to caregivers, always maintaining respect. And then also, what is the process that the brain is going through in dementia and kind of things that mimic dementia as well. So as we're approaching someone who appears confused or appears, not of typical brain functioning, what are the things that we as medical responders need to check for to make sure that we're not missing something as well. So this is going to be a common theme throughout our trainings for the next year. Just making sure that we're meeting the requirements under this House bill, and then two, also really making sure that the fire department as a whole is learning how to speak correctly to persons with dementia, and then always kind of keeping that in the back of our mind and making sure that we're not missing something that could be masked by just saying, oh, this is a person with dementia kind of thing. So just wanted to bring that up. Thanks.
Thank you so much, Kate. Do we have any questions for Kate?
No questions, but I just wanted to commend Kate. Thank you, because I think Kate was integral back when Dementia Friendly Arlington kind of launched and helping to arrange for the team of the different shifts getting trained. So you all, again, were way ahead of the legislation. And so just again, want to thank you for being such a tremendous partner.
Yes, exactly. I second that. And also it's, our frontline responders, have a lot of encounters with individuals and sometimes with tragic results. So it's great that this is being incorporated. So thank you so much. And thanks for your update. Do we have any other liaison updates? Okay. Any old business? I see we're getting near the end of our agenda. So any new business?
Hey, William, this is Charlie. Oh, I'm sorry. Go ahead.
Okay. Yeah. So Linda had her hands first, and then I'll go to Charlie. Thank you.
This was just an announcement. I read the article in the paper today about an 81-year-old woman voting for the first time because she didn't think she could vote because she couldn't read. And so I don't know what the county has available. I know that the political parties are out there providing transportation and so on, but I just wanted to emphasize how important it is to vote this time and how easy it is to vote at Long Branch or some of the other locations. There aren't any lines, there aren't any steps, and so on. So please vote and encourage your friends to vote. That's all.
Thank you, Linda. Yes, I always like to vote early, get it out of the way. I hate waiting in lines. So, and Charlie, go ahead, please.
Well, actually, following up on what Linda said, a model of voting for persons who, like the example Linda gave, was done in Vermont at a program that I worked on in my past life, and they got the voting officials to do outreach to nursing homes and assisted living facilities to register people who wanted to be registered and to help them to vote. And we also included training on how to communicate with persons who have some diminished capacity, so that you help them understand the process, but you didn't overstep your bounds in what you could tell them as a voting official. And that's something that we might want to explore as a future idea to explore in Arlington. But apart from that, the thing I was only going to say is that I wanted to say on the record that I really support and encourage the idea of our having everybody's short bios available to each other. I know Helen has put out a request for people to send in a short bio. And if you haven't done that, I really encourage you to send it in, because if we're, when human beings work together, they work together much better when they know more about each other than when they work as strangers. So just a short bio does a simple little thing to move that needle forward. So I encourage you to send Helen just a one paragraph bio.
Thank you. Thank you, Charlie. And just a quick update on that. I think Sarah Malala, our intern for this year, has been gathering all of those. And I think we are 4 short at the moment. So I'm not going to call anybody out in this meeting, but we'll send some emails separately. But we're close. So she's done a really great job gathering what we have so far. And we'll get those last 4 hopefully and be able to send that out soon.
Super. Thank you so much.
Go ahead. And William, can I just jump back real quick to what Linda shared just very briefly? I want to give Claire and Jim Morris both a shout out. Claire is very passionate about voting and making sure that the elections office and the registrar gets out to our long-term care communities. And so Claire, just thank you for your outreach and the connections there. And then did want to just emphasize that at the polls and then with early voting, there are assistive devices. If someone has a visual impairment, or if an individual is hard of hearing, and there's also an opportunity to request assistance. But I think to Linda's point, not everyone may know that. So again, I think it's not just the outreach committee that does this, but again, just making sure that we are serving as ambassadors in the community, and that it truly is an age-friendly model for people of all ages and stages. So thank you, William.
Yes, thank you, Rachel. I think I see Jennifer's note, but somebody else has had a comment. Go ahead.
This is Claire again. Rachel, thank you for recognizing me on my effort under the Long-Term Care Residence Committee to act as the voting somewhat coordinator. As you all know, I've been working with Tanya Griffin, who is the voter registration and Office of Election coordinator, outreach coordinator, and with her help, I was able to coordinate presentations to Mary Marshall, Sunrise of Arlington, Sunrise at Bluemont Park, Cherrydale. We also coordinated a presentation at the Carlin, which you helped me connect with them, Rachel, and also a presentation which is also a group of older individuals. It's the NARFE Arlington Chapter 7. We were also able to do a presentation there. So kudos also to Tanya Griffin, who is, as I said, the outreach voting coordinator. She does a fantastic presentation, and I look forward next year to add vitality on, because I had somewhat overlooked vitality, and add the other nursing homes and the well, I think we covered most of the assisted living facilities. But Rachel, thanks for recognizing my work and efforts. Thank you.
Yes, thank you to everyone. And also note that Jennifer noted Walter Reed also has early voting, Walter Reed Center, which is great. I mean, Arlington and I think Virginia does a great job in getting people to vote. Did I miss anyone who wanted to make a comment just now? Okay. All right. Unless there's anything else, our next meeting is on Monday, November 18, which is in person in Sequoia. Helen, is there anything else we need to mention?
Oh, I think that's it.
All right. Thank you, everyone. Have a nice Halloween. Please vote, and see you next time. Take care.
Thanks,
Bye, everyone.
Bye.
Thank you. Bye-bye.
Thank you, William.
Take care, everyone.